survive in colonies.
Oh, great. Hey, welcome back to AM Live. I'm here with Dr. Roda. And Doctor, I am very interested in talking about diabetes and oral health because I don't think people realize how important it is that your oral health really affects so many things in your body.
Mm-hmm.
And this is very interesting about how you're discussing the diabetic with oral health.
Diabetes affects many things. The problem with diabetes is that what it does is it affects your autoimmune system. It affects the ability of your white blood cells to actually behave correctly.
Mm-hmm.
The walls of your arteries and veins, capillaries thicken,
Mm-hmm.
which slows down blood flow at the periphery, and so external tissues don't get the oxygenation and nutrients they need. Waste products don't leave as efficiently, and so you see a lot of swollen gums, kind of oxygen-starved looking, kind of a little puffy.
Right.
And so there's a lot of oral manifestations, bleeding gums, soreness in the gums, dry mouth. So there's a lot of things that...
Burning mouth also,
burning mouth.
and tongue.
Mm-hmm.
And thrush is something to look for, am I correct?
Thrush. Yeah, thrush is it's candidiasis. It's a fungal infection. It's technically what we call a yeast infection.
Mm-hmm.
But it's an opportunistic one that you see in patients who are either immunosuppressed or, as in diabetes, where your immune system is suppressed anyway as a result of the diabetes. But it's opportunistic, particularly in diabetics, because it thrives on the increased levels of blood sugar in the blood and in your saliva.
Ah.
And so it's particularly hard to get rid of in diabetics. We often have to hit them over and over and over again with medication to try to get it under control.
Wow.
But if their diabetes is not under control,
then this is never going to be under control.
Problem.
Right.
And
now, if you are a diabetic or you have juvenile diabetes, then it's really important that you need to see your dentist at least 2 or 3 times a year.
Yes.
to make sure that your oral health is not being affected, because this can be quite scary for someone to go through, especially young kids, because we're having a rise on juvenile diabetes today, and I think that it's we don't know what the causes are. The fact remains is that once you're there, you need to take care of your dental and your oral health to make sure that it doesn't go into the rest of your body and cause some very serious medical problems.
Your oral health care affects a lot of things. When you have the problem with diabetes is you're going to have the results of inflammatory process in your mouth, and inflammation is plain bad. Anytime you have inflammation anywhere that's chronic, you're also at risk, at higher risk for things like stroke and heart attack.
Right.
Okay. So it becomes a vicious cycle, particularly with diabetes. When you have diabetes, you have more inflammation, you're more susceptible to infection. At the same time, when you have more infection and inflammation, it becomes harder to control your blood sugar. And so it becomes a vicious cycle. It's like a two-way street.
Right. So your body's constantly fighting your body. It's over and over. Do you now you suggest obviously that they brush after every meal?
Brush after every meal.
And use a good fluoride toothpaste?
Fluoride toothpaste.
Okay. Soft bristle?
Soft bristles. You don't need a hard brush to get plaque off your teeth. The name of the game is get the plaque levels down, because plaque is the number one thing that'll cause any kind of dental disease. And a soft brush is really all you need to get the plaque off without damaging anything.
Right, right. So what do you suggest for someone who is a diabetic or whatever? Should they bring in or make a list of all their medications and bring them into you so you're aware of what is going on with that patient? Because obviously there are different stages of diabetes and how it affects someone's oral health differently than someone else. It's just not, textbook. There are different stages.
Right. You have 2 types, of course. You have type 1, which is your insulin dependent. Those are the patients whose pancreas have ceased to function. You have the type 2, where your pancreas still has function, but it can't produce enough insulin for your body mass.
Okay.
That's the better one, because you can control that through diet and weight loss, so that your pancreas can provide enough insulin, although many of those people still have to take medication. The type 1, you're pretty much stuck with being dependent on insulin injections.
Right.
But it's important for us to know that we will want to know what your average hemoglobin A1Cs have been. And the reason that's more important than just your blood sugar will vary from day to day. but the hemoglobin A1C is more of an indicator of what your average blood sugar has been for the last 4 months.
Right.
Okay.
Right.
And so it gives us a better picture of whether your diabetes is
So
under
that would be a
control.
good idea for someone to go in and have tests done and then bring you the results so you can see what you're dealing with.
Yes, you can even do that in the office. We have a hemoglobin A1C machine in the
Oh,
office.
great.
And so, if we ever suspect diabetes, particularly if we have a young patient with all the signs of periodontal disease but with good oral health care and yet has periodontal disease,
Right.
or severe gingivitis, the first thing we have to think of is something systemic, and one easy thing to rule out is, are you diabetic or possibly diabetic? Well, the hemoglobin A1C will give you a pretty quick read on that.
Yeah, great. Well, Doctor, thank you so much for being with us, and please go see Dr. at Jackson Creek Dental Group, and if you have any idea at all or any inclination that there may be something wrong, this is the man to see, and I thank you very, very much for your expertise. With that, we're going to take a short break, and we'll be right back.